Hello everyone, this is your master Raven. This particular topic is a sensational topic because this particular thing happens each and everyone's home. If you have old age people, especially grandparents or even your parents or even yourself, it's all about that. A condition in our brain that is bipolar or amnesia or dementia. If something comes, how you would manage, everywhere you need to go hospital just like that. But I just thought to do it in a video because I just thought to discuss. The reason is that one is aware about this and people are just dealing wrongly, and it's time for a change, and that's why this topic. So first comes bipolar disorder. Bipolar disorder, formerly called manic depression, is a mental health condition that causes extreme mood swings that includes emotional highs, mania or hypomania, and lows, that is depression. When you become depressed, you may feel sad or hopeless and lose interest or pleasure in most activities. When your mood shifts to mania or hypomania, you might feel down and you would be irritated. These mood swings can affect sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely at multiple times a year. While most people will experience some emotional symptoms, some may not experience anything. Although bipolar disorder is a lifetime condition, you can manage your mood swings and other symptoms by following a treatment plan. In most cases, bipolar disorder is treated with medication and psychological counseling. And next comes amnesia. Amnesia is a condition that causes memory loss. There are different types of amnesia such as anti-growth amnesia, retrograde amnesia, transient global amnesia, and dissociative amnesia. Some of the causes of amnesia are brain injury, stroke, infection, lack of oxygen, certain drugs, and psychological trauma. Amnesia can affect a person's ability to form new memories, recall past events, or both. Amnesia can be treated depending on the cause and severity of the condition. Some possible treatments are medication, cognitive therapy, occupational therapy, and hypnosis. And next comes Alzheimer, the deadliest. It's a brain disorder that causes memory loss, thinking problem, behavioral changes. It is the most common cause of dementia, which is decline in mental abilities that affects daily life. Alzheimer's disease usually starts slowly and gets worse over time. It affects people of different ages, but it is more common in older age. There is no cure for this particular disease, and you have some treatment which may help with symptoms. Some of the common symptoms include memory loss that disrupts daily life, such as forgetting recently learned information, important dates or events, or asking the same question over and over. Challenges in planning or solving problems, such as following a familiar recipe, keeping track of monthly bills, or concentrating on tasks. Difficulty in completing familiar tasks, such as driving to a known location, or organizing a grocery list, or remembering the rules of a favorite game. Confusion with time or place, such as losing track of dates, session, or the passage of a time, or forgetting where they are, how they got there. Trouble understanding visual images and spatial relationships, such as having difficulty with balance, reading, judging distance, or determining color or contrast. New problem with words, all these things are just painful, when these things come to our body, just imagine how we would. So we must have patience. And next comes the biggest, that is dementia. Dementia is a term used to describe a group of symptoms affecting memory, thinking, and social ability. It is not one specific disease. Several diseases can cause dementia, such as Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and others. Dementia can affect people differently depending on the cause and the area of the brain that is damaged. Some common symptoms of dementia include memory loss, confusion, difficulty in communicating, problems with reasoning or problem solving, changes in personality and behavior, and dementia can interfere with person's daily life and activity. There is no cure for most types of dementia, but some treatments may help with symptoms or slow down the progression of the disease. If you or someone you know has signs of dementia, it is important to see a healthcare professional for diagnosis and treatment. So you'll be seeing some of the risk factors for developing dementia. First one comes about the age. The risk of Alzheimer's disease, vascular dementia, and several other dementia goes up significantly with advancing age. And next comes genetics or family history. Based on that, researchers have discovered a number of genes that increase the risk of developing Alzheimer's disease and other forms of dementia. Although people with a family history of Alzheimer's disease are generally considered to be at a heightened risk of developing the disease themselves, many people who have relatives with Alzheimer's disease never develop the disease, and many without a family history of the disease do get it. And next comes smoking and alcohol use. Several recent studies have found that smoking significantly increases the risk of mental decline and dementia. People who smoke have a higher risk of atherosclerosis and other type of vascular disease, which may be the underlying cause for the increased dementia risk. So I have found that drinking large amounts of alcohol appears to increase the risk of dementia. However, other studies have suggested that people who drink moderately have a lower risk of dementia than either those who drink heavily or those who completely abstain from drinking. And next comes atherosclerosis. Atherosclerosis is the buildup of plaque, deposits of fatty substance, cholesterol, and other matter in the inner lining of an artery. Atherosclerosis is a significant risk factor for vascular dementia because it interferes with delivery of blood to the brain and can lead to stroke. Studies have also found a possible link between atherosclerosis and Alzheimer's disease. And next comes about the cholesterol. Cholesterol, high levels of low-density lipoprotein, which is so-called bad form of cholesterol, appear to significantly increase a person's risk of developing vascular dementia. Some research has also linked high cholesterol to an increased risk of Alzheimer's disease. And next comes plasma homocysteines. Research has shown that a higher than average blood level of a homocysteine, a type of amino acid, is a strong risk factor for the development of Alzheimer's disease and vascular dementia. And next comes high blood pressure, that is hypertension. That is, high blood pressure can damage blood vessels in the brain and increase the risk of stroke, which can lead to vascular dementia. High blood pressure may also play a role in Alzheimer's disease by affecting the blood flow to the brain. Next comes high blood sugar. Diabetes again. Diabetes can damage blood vessels throughout the body, including in the brain. This can increase the risk of stroke and vascular dementia. Diabetes may also increase the risk of Alzheimer's disease by affecting insulin levels and glucose metabolism in the brain. And when you have this particular disease, when there is a hurt in the body, your recovering process would be slow. And next comes being overweight. Being overweight can increase the risk of diabetes, high blood pressure, high cholesterol, and cardiovascular disease, which may risk to the factor of dementia. Some studies have also suggested that obesity may directly affect brain health and increase inflammation in the brain. Next comes being physically inactive. Physical activity can help prevent or manage many health conditions that are risk factors for dementia, such as diabetes, high blood pressure, high cholesterol, and cardiovascular disease. Physical activity may also have direct benefits for brain health by increasing blood flow, stimulating nerve growth, and reducing inflammation. And finally, it's all about living alone. Living alone may increase the risk of dementia by reducing social interaction and cognitive stimulation, which are important for brain health. Living alone may also make it harder to detect early signs of dementia or seek help when needed. And the most important, being male. Men are more likely than women to develop vascular dementia, possibly because they have higher rates of stroke and cardiovascular disease. Men may also be less likely than women to seek medical attention or follow treatment plans for their health condition. All these things, all these factors are really important for you to go through, because all these conditions would be happening for our generation in 50s, 60s, 70s, just like that. In our old generation, it is all about 60, 70, 80. And this is really painful, because if you don't have money to treat this particular disease, you would be in a way where that in order to search your death, because you need the help of a person to lead a life. That is a horrible thing for any human being. It's all about the painful moment. This particular process is not easy for any human to withstand, but please do have patience to understand the problem of the patient, so that you would understand when a situation comes for you, you would be facing the same thing. Okay. So I hope this video was so informative, and I'm not a doctor, but I just love to share all this information for normal audience. And I hope this video is informative. So with that thought, I'm in this video. Take care. Have a nice day.